Micronized creatine is monohydrate. The chemical formula is identical, the compound is identical, the mechanism of action is identical. What changed is the particle size. Standard creatine monohydrate particles are relatively large, in the range of 200 to 400 microns. Micronized creatine has been mechanically milled into much smaller particles, typically under 50 microns. This is a physical processing step, not a chemical modification. You are not getting a new molecule. You are getting the same molecule in a finer powder. The practical effect of smaller particles is improved suspension in water. When you mix micronized creatine with liquid, it disperses more uniformly and stays suspended longer. Standard monohydrate, particularly high-quality pharmaceutical-grade material, tends to form a gritty, partially dissolved suspension that settles quickly and leaves a powdery layer at the bottom of the glass. Micronized powder largely eliminates this. Whether improved suspension in a glass translates to meaningfully different gastrointestinal behavior is debated. The case for it goes like this. Smaller particles present a larger surface area to intestinal digestive and absorptive processes, which could theoretically speed the rate of absorption. This is the general principle behind pharmaceutical micronization of drugs with poor water solubility. The counterargument is that creatine monohydrate's absorption is already very efficient. Estimated at greater than 90% of the consumed dose in healthy individuals at standard supplemental doses. If absorption is already near complete, improving it marginally by reducing particle size produces no meaningful change in how much creatine actually reaches muscle tissue. The research comparing micronized and standard monohydrate does not show significant differences in muscle creatine loading or in exercise performance outcomes. Where studies have measured blood pharmacokinetics, the speed and magnitude of creatine appearance in blood after a dose, some show slightly faster peak levels with micronized formulations, consistent with the surface area theory. But faster absorption kinetics do not necessarily translate to greater total uptake, and the evidence for a meaningful muscle loading difference is lacking. Where micronized creatine does offer a genuine advantage is in mixability for people who care about it. If gritty texture is the thing that makes you inconsistent with supplementation, micronized monohydrate is the practical solution. The improvement in texture and suspension is real and noticeable. That is a legitimate reason to choose it. The cost premium for micronized creatine over standard monohydrate is usually modest, unlike the premium for chemically distinct alternative forms. The milling process adds some manufacturing cost, but not dramatically. Many reputable supplement brands offer micronized monohydrate at a reasonable price difference from standard monohydrate. There is also a question of what micronized means across different brands. The term is not standardized. One brand's micronized product may have particles averaging 40 microns. Another's may average 80 microns. Without particle size certification on the label, the micronized label is informative but not precise. The more important quality variable for any creatine monohydrate product is purity, not particle size. Creatine with a high purity certificate, confirmed through independent third-party testing, will perform consistently regardless of whether it is standard or micronized particle size. A highly pure standard monohydrate will outperform impure micronized creatine every time. Micronized creatine represents a legitimate product improvement in the sense that it makes an already effective supplement more pleasant to use, but it does not represent a performance upgrade. If you are trying to improve your muscle creatine loading outcomes, micronized versus standard is not the variable that matters. Consistency of daily dosing matters far more than particle size. One area where micronization does offer a meaningful advantage is in high-dose mixing. During a loading protocol, 20 to 25 grams per day split into multiple servings, the grittiness of standard monohydrate at 5-gram servings is manageable. But when mixing larger single servings, the undissolved particulate in standard monohydrate becomes more noticeable. Micronized monohydrate handles this better. For athletes who supplement creatine in protein shakes or other beverages where texture matters, Micronized monohydrate integrates more smoothly without the chalky residue that standard monohydrate can leave. This is a practical convenience with no performance implication, but it is not trivial if it affects adherence.